Hi everyone, good morning. I am Zsófia from EFIC European Pain Federation, and I am here today to talk with one of our plenary speakers who will be with us in Lyon in 2025 April in our next Congress. Hi Michelle, nice to see you.
Hi, Sophia. Lovely to meet you.
Thank you so much to give us your time. Today we are going to talk about your plenary session. Could you please briefly introduce yourself and your work before we aim the session?
Sure, no problem. My name is Michelle Roche. I am an associate professor in physiology and co-director of the Centre for Pain Research at the University of Galway in Ireland. I'm also the current president of the Irish Pain Society. My research focuses on understanding the neurobiology that underlies mood and neurodevelopmental disorders, on pain, and then really the interaction between mood, development, and pain. And I have a particular interest in the role of neuroinflammation and neuroimmune crosstalk, the opioid system, and endocannabinoids in these conditions. So I was really delighted to see that the theme for this year's EFIC 2025 meeting was the comorbidity between pain and mental health disorders, because this is an area I've been working in for about 20 years. It was great to actually be invited to give a plenary talk at the meeting.
That sounds actually wonderful, and yeah, that topic really suits the main topic of the Congress. I also thought about it. Um, what key message do you hope the audience takes away from your plenary session?
Yeah, my talk's going to be primarily focused on looking at animal models of chronic pain and mood disorders and how they can be used to study the comorbidity between them. So some of the key messages that I'm going to try and get across is that these models should be really combined and informed by clinical and translational research to make them more relevant to the human conditions, to highlight some advances in the field that have been developed over the last number of years that have really kind of helped with our understanding of the neurobiology of these conditions in isolation, but also their comorbidity, and then how they can be used to identify novel therapeutic targets and strategies that could ultimately improve the quality of lives of those living with these comorbid conditions.
Why do you think this topic is especially relevant today?
Great. There's I suppose it's ever increasing recognition of this interaction between mood, mental health, and pain. And we know that chronic pain generally doesn't occur in isolation. It's got a huge comorbidity, and these mental health disorders account for maybe 50% of patients that have a chronic pain condition. And on the flip side, if you have a mental health disorder, you're almost twice as likely to develop chronic pain. So there's this real yin yang between mental health and chronic pain. And animal models provide really an important tool to study this really complex neurobiological system. They're not without their limitations. They're not the only thing that's available. And there's been massive advances in the development of non-animal based models of diseases, like using iPSCs and organoids and computer modeling in recent years. But I still believe that animal models, when they are developed and used and informed by clinical research, can provide really important tools in our understanding of these conditions and the development of new treatment protocols.
What do you think? What are like the key neurobiological mechanisms that these models help us to understand?
Yeah, so that's quite a large question. So there are so many different systems. So the the animal models can be used in a variety of different ways. One is that we can use them behaviorally to try and look at behaviors that mimic what happen in the clinic. Now we can't model everything that you see in the clinic. We can't ask an animal how it's feeling, etc. But we can use um, certain paradigms in order to test their stress reactivity, their ability to deal with certain situations, their lack of interest, this anhedonia, that's a core feature of mental health conditions. The advancement of more machine learning, of computer-based systems that are going to assess non-evoked measures of pain and anxiety and depression have been a huge advancement to the field, and they'll more closely mimic what we have in things. So yeah, we can use it behaviorally, but the systems and the neurobiology, there are so many circuits now that we know are involved within the brain that are involved in both the somatosensory aspects of pain perception and the emotional aspects. And these same circuits are altered in these comorbidity conditions. So yeah, lots of different ones. Every researcher may have a different focus, but that's no harm. There's intersection between them in many cases.
That sounds really exciting, actually. And to whom would you recommend your plenary session based on all of these?
Yeah, so I think I would feel that the plenary session would be relevant really to anyone that's attending EFIC conference. So obviously at a basic science level, preclinical researchers would get an update on the current models that are being used in the field, what advances are in the field, what gaps might be in the area, and also kind of key considerations if people are thinking of working in this particular area. Not all models are the same and what should be considered. For clinical researchers, I think they'll get an overview of the advances that have been made in animal models and the assessments that mimic what they see now in the clinic. So, where has the field actually come from and how can it be even more informed by the clinic and vice versa can inform on clinical practice? And where can that kind of yin and yang actually happen? And then for industry, of course, there are many different aspects, industry that are interested in developing new tools to help with the assessment of these behaviors or these electrophysiological assessments in animal models. There's a huge need there. But also in the pharmaceutical industry or biomedical industry to develop new therapeutic strategies for the management of pain and its comorbidities.
That sounds fantastic. Thank you so much. Would you like to add anything else about your session?
No, I think I'm delighted to have been asked to give this talk. I'm really excited to come to Lyon, to come to EFIC, and I look forward to seeing as many people as possible in a few months' time.
Thank you so much, Michelle. We are looking forward to meet you personally in Lyon and in France in 2025 in the next EFIC Congress. So thank you for your time for now, and hopefully we are going to meet pretty soon.